Welcome to Old Guy Talks to Me, a podcast dedicated to helping guys create kick-ass lives for themselves and those that they love. Ladies, if you want to know what your guy is thinking, this podcast is for women too. Each week, a special guest helps you create that life you've imagined. We talk anti-aging medicine, personal growth, relationships and hot sex. Yeah, you hear me, getting laid more frequently. Other guy vices, and topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Don't want to miss anything? Be sure to subscribe, share, rate, and review this podcast. And be sure to go to www.thestandard.academy/magazine and grab a free copy of our new digital magazine, The Standard Academy, where we talk about erogenous zones, growing hair back, and other things that will help you create that kick-ass life. Now get ready to listen up and share with friends.
If you have issues, and the blood work never lies, get blood work done if your hormones are messed up, go to a provider. But a key question to ask is how long have you been doing it, right? Mm-hmm. And how many patients are you managing, right? And if they just learned it a year ago, or they just started it, I would probably try to find someone with more experience, right?
Yeah. Now, we were talking before we got started recording. We're talking about another regenerative product that has kind of come on board, and let's talk a little bit about that.
Yeah. So there's another. It's not new, but you're starting to see more of it. There's another product that we can make from a person's blood, which is considered autologous, called alpha-2 macroglobulin. Okay. And just to keep things really simple, these are all proteins, to keep it really simple. So platelet-rich plasma are proteins we capture from a person's blood and inject back into an area. A2M is the same thing. We take a person's blood and we capture this protein out of the blood now and put it into a joint. And the reason that A2M is really unique and amazing is anybody who's listening here who's been diagnosed with osteoarthritis or degenerative joint disease, which, usually if everyone's going to have it at some point in some joint in their body. And the reason you get osteoarthritis or degenerative joint disease are the same exact thing, by the way, is either due to overuse, like you played soccer your whole life, or lift heavy bench press your whole life, you could get in your shoulders. You have some type of trauma, you hurt your knee, you hurt your shoulder, or after surgery. We often see it. If you've had a meniscus surgery, an ACL surgery, you're going to end up with osteoarthritis downstream, especially if you've had that past 30 or 35 years of age. And the reason why is pretty simple. So the way you get arthritis is you get an injury or you have a meniscus surgery when you're 40. And that creates a lot of trauma to the area. So your body, in response to that trauma, releases these proteins called proteases. Okay. And the reason your body secretes is it serves a good purpose. They're there like little Pac-Man. They clean up the damage. So you have a meniscus surgery or a shoulder surgery at 40 years of age. There's tissue in there left over from the surgery. Your body releases these proteases, which are little Pac-Man. They go there and they basically chew up and get rid of that tissue. The problem is this: once you get past about 35 years of age, your joints become very avascular, really bad circulation. Those proteases, which are little Pac-Men, are stuck in that joint. So when there's nothing left to clean up, guess what they start to chew on?
The good stuff.
The cartilage, the synovial fluid, and the collateral, the ligaments and everything around there. So anybody that has osteoarthritis or degenerative joint disease, it's always caused by proteases being trapped in the joint. Okay.
So one of the things that I use, and just so everyone knows, I'm not a physician. I'm no longer a practicing dentist. I'm unlicensed. So this is just an opinion. I say it'd be promote an affiliate product was a acoustic wave device. And because acoustic wave therapy has been around forever. I mean, it's nothing brand new, but this particular device, and there'll be a link to it in the show notes, but this particular device is actually for erectile dysfunction. And the story is that this company made this at-home version, and it puts out the same signal as the real popular one, the Gainswave system. And the gain, it puts out the same, basically, essentially the same acoustic signal, but now the Gains Wave company is selling it to through their physicians to patients for at-home therapy. But it works, but it works very well on joints. And I like if I get like an injury, that I will just use that device along with maybe some topical therapeutics. But I've noticed that it just seems to work pretty well. You have a full full series of things that you can do for your patients, and how do you, as an experienced practitioner in this field, how do you decide? Am I doing PRP? Am I doing the other one? I can't remember the one you just talked about.
Alpha 2 macroglobulin.
Alpha 2 macroglobulin.
A2M.
Do you do peptides? Do you do exosomes? Do you do stem cells? How do you work through all those tools that you have at your disposal? And what's your kind of decision tree look like?
Yeah, great. That's a great question. So, going back to the A2M, so the way A2M works, and A2M is produced by your liver, 99% is produced by your liver. And it's another very large protein. But A2M is another big Pac-Man. And what it does is it binds on to proteases. So it literally, those proteases in your joint, if we basically take your blood, we capture the A2M out of your blood, we spin it down, and then we inject that A2M back into a joint. And when that A2M is in the joint with the proteases, which are causing arthritis, it binds with all the proteases and literally stops arthritis at the molecular level. So A2M is, if someone has osteoarthritis or degenerative joint disease, it's the only way to stop it. PRP won't stop it. Exosomes won't stop it. Stem cells won't stop it. So if someone has osteoarthritis, you always start with A2M. Now, if someone has a tendonitis or a partially torn muscle, that's the wrong tool, because when you have a partially torn muscle or a tendonitis, then you want to take that area and help it heal quicker. You want to put growth factors there. So that's where PRP would be a better tool. Or if I want to have someone's hair grow back, or for a facial, I want growth factors. So think of growth factors as fertilizer. So, when you're dealing with a person's health, let's think of it in terms of it's a garden. Okay. And when someone's getting older or breaking down, the garden is dying quicker than it's growing, right? But people have to realize, if you're alive, you have the ability to heal, right? And if you doubt that, if you broke your leg, would your leg heal? If you got cut, would your cut heal? The answer is yes. So when you have an injury that's not healing, it's because it's breaking down quicker than it's repairing itself. So, as an interventional orthopedist or regenerative medicine doctor, we look at someone, what can we do to get that thing to heal quicker than it's breaking down naturally? Okay. So, you had mentioned, a shock wave or sound wave material, those are great too. We use those in our practice. That increases circulation to the area. It wouldn't reverse arthritis because it doesn't get rid of the proteases, but it can help basically get more circulation, which does help the healing process. Just like peptides, there's a lot of good peptides. BPC 157 we use a lot. That also helps, reverse and get rid of inflammation. So, but it really depends on what the injury is. Osteoarthritis, A2M is always the first tool. And once you get rid of it, so think of it, so you have a garden that's getting, I always tell people, think of it, when you have osteoarthritis, it's kind of like a garden that is infested with beetles. Now, proteases aren't beetles. You don't have bugs in your joint. But think of it, they're eating the joint quicker than the joint's growing back. So I could choose to put fertilizer in the garden, and the garden could outgrow the beetles for a while. And fertilizer would be something like PRP, or umbilical cord tissue would be much better than exosomes. Those are really good fertilizers. But if you don't kill the beetles, what's going to happen? Eventually, the garden's going to, they're going to eventually overtake the fertilizer and break it down. So sure. A2M, get rid of the beetles, and then hope the garden grows back. Now, I'll tell you, sometimes, depending on the person's age, you can get rid of all the beetles, but if someone's unhealthy and their hormones are messed up, the garden still might not grow back. And then you might have to put PRP or stem cells or exosomes after to help grow once you got rid of the proteases. Does that make sense?
Sure.
So it really depends on what the injury is. Osteoarthritis, A2M is always first line. For injuries, though, then PRP, and the two choices would be PRP or something like an umbilical cord tissue extract. umbilical cord tissue is always going to be better, but not always necessary, and it's more expensive. So typically we would start with PRP first because it's less expensive. And if someone really had poor health and their platelet-rich plasma wasn't good, then we could talk about using, some type of birth tissue product. That's kind of our metrics. And sound wave therapy never hurts anything, so you can always do that. Class 4 lasers are very good. Peptides are, those will never hurt for sure. So those would all be ancillaries.
Okay,
And then,
great.
and you had mentioned you're doing functional medicine. We do a lot of functional medicine too. If someone's hormones are really messed up, you probably know this from even in practice. If you have no testosterone, no estrogen, you're not going to heal. So that's why I think, if someone really wants to live and be their, be in their best shape and heal like a young person, you got to have all the tools in your toolbox.
Yeah.
If you missed that URL, it's in the show notes. Don't worry, it's right there for you to use. This is Oris from the Standard Academy, a men's lifestyle coaching program. Let me ask you, have you paid a price? Have you paid a price in other areas of your life for your professional success? Yeah, you know what I mean. Are you just in a roommate situation with your wife? Or are you arguing all the time? Certainly there's no sex. And your kids, do they ignore you? Or worse yet, do they disrespect you? Is that your case? Is your life not working out the way you had planned? If so, I'm going to encourage you to revitalize yourself and get on a short activation call with me. That's right. Get on a short call with me. And I will, share with you some things that you can do to bring back that energy into your life. Go to the Standard.Academy /15-minute activation call and schedule now. That's /15 activation call and schedule that right now. Don't wait. Don't hesitate to procrastinate. This is your opportunity to start the turnaround in your life.
It was a year ago, in January in 2022, I had very bad diverticulitis, which was going on, and I ended up in the hospital, coming out with an ostomy bag.
Oh wow!
And believe me, that actually, I had a friend of mine interviewed me for my podcast where I talked about that whole experience. I talk about rocking your world. This probably was one of the most physically, emotionally, intellectually challenging times I ever faced. But I eventually, several months later, I got reconnected. And for those of you who don't know what ostomy is, basically your colon is separated from your intestine and you shit out through a hole in your stomach without any control. So my morning
that'll affect your lifestyle for sure.
Oh yeah. I mean, I literally, my wife is a saint because I would literally, for about an hour and a half in the morning, I'd wake up and I'd literally just shit on myself, and then she'd help me clean up. And because we couldn't get the bag to stick for a while, we went to all sorts of doctors, and finally we found one that did. But I got put back together again. But I was out of the hospital on the putback the very next day. And I mean, I healed up very quick. And I was talking to a friend of mine who's an androgen expert, and he said, "Oh yeah, that's because of the testosterone that you're taking." I mean, I literally, the doctor was just stunned, and I was like, "I'm ready to go."
Well, he probably expects you to heal like someone who's your age, not like a younger person.
Right. So, but it was, you're absolutely correct.
And the way I always explain to people, keep it in simplest terms. These hormones, testosterone, estrogen, this is how your cells communicate, right? So, if you could take, we'll say like a Navy SEAL, these guys are the highest trained warriors, right? And you put them in any combat situation, they're going to be kicking some ass. But if you take away their ability to communicate, how are they going to do it? They can't communicate at all. And that's when someone has no hormones or very decreased hormones. That's what you're asking your body to do. Your body, if your cells can't communicate, you don't have this endocrine system functioning properly. I don't care what you do, things aren't going to heal and things aren't going to work out well for you, right? So, anyone that listens to the show, obviously you have a lot of people listen to the show that aren't your average older people. They're trying to live their best lives. And I always tell people, it's not about your lifespan, it's your health span. How healthy are you? I mean, if I can be 80 and still working out and jogging, I'll take that any day over being 120 and being in a wheelchair any day.
this whole thing, we kind of got off because we were start off with, and I just want to maybe just kind of touch a little bit about this testosterone thing. What most people don't realize is that there's been a huge generational decline in testosterone levels in men.
Oh, it's ridiculous. Well, they've changed the normal lab values.
Absolutely
changed their values.
Yeah.
No one even reports on this. It's like a huge deal. Like, and we in our clinic, we see, and people don't realize that, we have 1,000 patients we're treating right now, a little over 1,000. So I see these blood works every day, and like, it's to the point now that you can't even say it's age related, because we have people that are literally in their late 20s that have really low testosterone of like a 7-year-old.
Yeah, well, that's what I was going to get at. I have a friend whose son is 23, and we suspected, and he went in, and his lab value was 300. He's 23. He was 300. That was like
the environment. It's the plastics. It's there's a lot. Yeah. There's a lot of factors, obviously, and then when you're older, getting on bioidentical hormone replacement therapy is obviously the right choice. And younger people, often when someone comes in younger in their 20s, or you even have teenagers, they'll come in at real low testosterone, which is crazy, right? But they present it, what people don't realize is the symptoms of low testosterone and depression are mirror images of each other. So the issue is, as a parent will take their high school kid to the doctor and say he's not motivated, he won't get off the couch, he's, this, that, the other thing. The doctor's never going to check their hormones, because he's a teenager, he can't have low testosterone. So they'll put him on depression medications, and they'll come to us, and they'll have, like, case in point, I have a 16-year-old son, my son Brock, plays sports probably was overtrained, plays sports year round, really good kid, was getting injured all the time. And as a typical father, suck it up, sure, kind of being a hard ass. So he's like, Dad, can we test my hormones? I said, yeah, sure. I didn't expect to find anything. My 16-year-old son, testosterone level was in the 300s, and we eat healthy.
Yeah,
so
it's insane.
Yeah, so then we test his adrenal glands. So your adrenal glands have a lot to do with hormone production when you're younger. His adrenal glands were shot. He was phase 2 adrenal failure. So fixed his adrenal glands. Now he's doing great. Now, in an older person, I think you're not going to get much out of fixing adrenals, but anyone below 30, we test adrenals. If there's adrenal failure, fix their adrenals with proper diet and supplementation, and their hormones come right back.
Yeah, so it's a sad thing, and the thing, people go, well, your lab, your values are within the normal range. Well, normal ain't healthy.
I don't want to be a normal 70-year-old. I want to be a normal, the best is you want to be, like a normal, healthy 30 to 35-year-old. That's when you heal the best, you have the least issues. And people got to realize they're not steroids, they're bioidentical hormones. So basically you're simply replacing with the exact same hormone your body used to produce. There's nothing synthetic about it. So anyone who suffers with chronic pain, anyone we put through our Regen Med program, we're doing PRP A2M stem cells, we always do blood work on them, because even if you use the best PRP, the best A2M, if you don't have, if you're a female postmenopausal and you have no estrogen, you're not going to have osteoblastic activity. You're not going to rebuild anything. If you're a male and you have low testosterone, you might get a little bit of relief, but you're just going to continue breaking down. So if you really want to have a good health span and be healthy into your 70s, 80s, 90s, and work out and enjoy yourself, you're going to have to address this hormone thing for sure. At least in my opinion.
Absolutely. And so, Buzz, where's your clinic is in Ohio, I gather?
Yep, we're in Ohio. We also have a location in Miami. So, and we're doing this stuff here. But as I said, we kind of look at, you asked earlier, what tools do we use? We have, sound wave machines, class 4 lasers, pulse electronic magnetic frequency, PEMF. I don't know if you know much about that. We could probably do several podcasts on that. PRP. We're doing all these things. So, when someone comes to one of our clinics, I look at you as a whole. If you have elbow pain, that's a warning sign, but why isn't your elbow healing? So look at you as a whole. It's because your hormones are messed up, is you have some sort of chronic infection. Look at the person as a whole, because there's a reason you're not healing. Because if you're alive, you should heal, is the end of the story.
Yeah, absolutely. Well, I want to thank you for coming on the podcast and shedding some light on regenerative therapy and the ins and outs. and appreciate.
Make sure your
we'll
people are looking into it. If you're sitting there and you're listening to this podcast and you're not exercising or you're not doing playing with your grandkids or doing whatever you want to do because you have some type of injury, no excuses. Get off the couch and get find a good provider and get the thing checked out. And don't go to your primary care and get a cortisone shot or get on anti-inflammatories. That's not fixing anything. Find someone who's going to help you fix, help your body heal itself. That's what you should be looking for.
Absolutely. Well, again, thank you. And we'll have to have you on. We'll talk about maybe some of the other stuff that you do. So this is Oris, the official old guy. And if you have not already done so, well, I want you to sign up for my free digital magazine by going to the standard.academy/magazine. And there's some articles in there that'll help you create the life that you want, including one on one secret place to touch a woman. And as I've said before, it's not her clitoris, because that is not the secret place. So there's another secret place. So until next time, remember, it's all about creating a kick-ass life for yourself and those that you love.
Thanks.